Next bill. This opens the hearing on House Bill 269. Representative Swanson, the lectern is yours.
Thank you, Mr. Chair and members of the committee. Good morning. My name is Kathy Swanson. I'm from House District 86. This includes Anaconda, most of Anaconda, Deer Lodge County, Phelpsburg, Hall, Drummond, and bumps against Missoula County. That's a vast and beautiful area. I bring to you House Bill 269. It's been introduced by the request of the Montana Nurses Association, but as you will note here today, enjoys broad support from a wide cross-section of healthcare organizations and facilities, law enforcement, and individuals impacted by violence against healthcare workers. You might ask what makes healthcare workers so special as to warrant a separate, additional law regarding assault. For nurses, the answer is easy. According to a survey conducted by the Emergency Nurses Association, every week in the United States, between 8 to 13% of emergency department nurses are victims of physical violence. 54.8% of nurses surveyed reported experiencing physical or verbal abuse at work in the last 7 days. The United States Department of Justice reported that nearly 500,000 nurses annually are victims of violent crimes in the workplace, and nearly 50% of non-fatal acts of violence against all workers occur in the healthcare industry, with registered nurses and licensed practical nurses sustaining the highest proportion of such injuries. In fact, assault against healthcare workers has become such a national problem that the American Nurses Association reports that it is now a felony to assault a nurse in 38 states across the United States. Montana has a somewhat similar law in place for our law enforcement personnel, where incidents of violence against a law enforcement officer can result in a felony, punishable by a term of incarceration of no less than 2 years, nor more than 10 years, and a fine not to exceed $50,000. Even officials at sporting events are recognized as individuals whose attackers are subject to additional charges and penalties under the law that are healthcare workers. House Bill 269 reflects an approach focusing not only on stiffer penalties, but on treatment, rehabilitation, and restitution as well. This bill establishes that the offense of an assault on a healthcare provider or an emergency responder is a crime punishable by up to 10 years incarceration with no minimum established, and a fine not to exceed $50,000 or both. In addition, a person convicted of offense of an assault on a healthcare worker or an emergency responder is required to pay for and complete a counseling assessment with a focus on violence, controlling behavior, dangerous and chemical dependency, and if treatment is ordered, the offender is required to complete all recommendations for counseling, referrals, attendance at psychoeducational groups or treatments, including chemical dependency treatment if ordered. After determining the financial resources and future ability of the offender to pay restitution, the court can require the offender, if able, to pay the victim's reasonable actual medical, housing, wage loss, and counseling costs. This is stated in the new section 131 sub 3 and A. If financially able, the offender must be ordered to pay for the costs of his or her probation if the probation is ordered by the court. Finally, the court may prohibit the offender from possession or use of any firearm used in the assault. Mr. Chairman, members of the committee, it's easy to imagine and likely that Montana has already experienced situations where both a law enforcement officer and a nurse or emergency responder were the subjects of an assault when dealing with the same offender. While the assault on the law enforcement officer is a felony, the assault on the emergency provider is currently treated as a misdemeanor. That seems blatantly unfair, and House Bill 269 is an effort to correct the situation. Mr. Chairman, members of the committee, there are people here who can much better state this case. I will sit and be available for questions and reserve the right to close.
Thank you, Representative Swanson. Could I see a show of hands of the proponents that are wanting to testify? How many are going to testify? Okay, all right. Opponents then that are wanting to testify. Okay, similar. All right. We'll allow 30 minutes for each side to state their case.